Okay. Dr. Kumar is on.
Okay. Mayor and Council, I have Dr. Hoke from the same office, and he will be giving the presentation tonight. Mike, is he on?
Yes, Dr. Hoke and Dr. Kumar, they both have been moved over.
Great. Okay, thank you.
They can simply unmute their mics.
Hi, everybody. Give me 1 second to try and share my screen. Well, I guess I cannot share one. Okay.
You should be able to share now. I stopped sharing mine.
Great. Are you guys able to see this?
Yes, we can.
Okay, great. Okay, so hey guys, my name is Dr. Hoke, or Bob Hoke. I'm the EMS fellow at Emory University currently, so I'm just gonna give you guys a quick talk on essentially COVID vaccine. I know there's a lot of questions that have been going on about everything. So hopefully we could clear some of it up and make everyone feel a little bit more comfortable. Okay, this is my email address in case anyone needs it. Okay, so the COVID vaccines, the ones that have been in the news, the ones that have been approved in the US are the Moderna and the Pfizer vaccines. These are the ones everyone's been talking about. They use the mRNA sort of technology. The other vaccines that have been talked about are AstraZeneca, and some of the other ones. These are not yet been approved in the US, but should be in the coming months. For today's talk, I'm really just going to focus on Moderna and Pfizer since that's what people have been receiving, and I would presume most of the questions are about that. mRNA vaccines. So like I said, new technology, lots of questions as to how this works, I think, amongst the general public. This is like a sort of picture representation. So essentially the red bumps on this circle here, which is supposed to be the virus, are spike proteins. In general, when it would get into your body would try to produce an immune response focused on recognizing these spike proteins and then attacking them. So what does this vaccine do? The vaccine creates this messenger RNA, which is essentially like a telegram or like a little message about how to make the spike protein. It never actually enters the nucleus of the cell, which is like the brain of the cell. It stays out in the sort of cytoplasm, so to speak, but it makes the cell create the protein there and then show it on its outside. The rest of the body then sort of sees that, wonders what's going on, and it learns how to attack it when it needs to. So essentially, this is just giving your body a heads up and instructions on how to recognize and sort of attack the virus if it were to come in contact with it in the future. This is essentially the same thing. So this is different than the prior vaccine forms that we're sort of used to. In the past, what we used to do is use either viral vector vaccines, where we would use a different weakened virus to sort of give the body a same experience, or just use vaccines that were purely the virus, where it's like a weakened form. Some of the upcoming vaccines use that pathway, but those take longer to make, and therefore they're a little bit behind. Now, these, although it feels like this is fast, these have been like massive trials. The idea was that because of this new technology, we didn't need to like culture the virus and like develop a weakened one. That saves a massive amount of time. So we were actually able to start working on this before there was even a single case in the US. And then on top of that, we were able to accumulate a massive amount of participants, both in the US and worldwide. So we have over 43,000 participants, and it was randomized placebo and vaccine groups. Both had two doses. They actually did enroll, well, for the Pfizer group, they did enroll people as young as 12. And they tried to keep things ethnically diverse. They essentially tested this up until 170 cases of COVID between the two groups. And that's where their endpoint was. And we'll go into that next, just because I wanted to make this more specific than just ethnically diverse. Percentages, they said, were about 82% white, 26.2% Hispanic or Latino, 9.8% African American, 4.4% Asian, and then less than 3% are other races and ethnicities. It was about 50-50 male, female, 21.4% were over 65 years old. And then most frequent medical conditions that people had were obesity, which was like 35%, diabetes, 8.4%, and then pulmonary disease at 7.8%. So what did we find during the Pfizer trial was essentially that within the first 170 cases, 162 were in the placebo group and 8 cases were in the vaccine group. This was consistent across ages, genders, races, and ethnicities. Also significantly, amongst the severe cases, which are cases that put people in the hospital, almost all of them were in the placebo group, 9 out of 10. There were some side effects, but generally they were limited. The most common side effects being reported for the Pfizer vaccine were injection site reactions, which was 84% people, fatigue, which is like 62, there's chills, muscle pain, joint pain, headaches. There weren't really any severe side effects. And the way they actually categorize severe or side effects that keep people out of work, not anything else. But there were no deaths from the vaccine.
Dr. Hoke?
Yep.
This is Mayor Motley Broom. When you're discussing severe cases, are those cases that get people in the hospital? What's the definition of a severe case?
My understanding of a severe case where you have cases that put people into the hospital.
Okay.
And require respiratory support.
And one other question. The mRNA technology that was used to develop the Pfizer and Moderna vaccines, it's my understanding that has been something that has been in the works for a long time. Now, I know a lot of people are concerned with the speed with which these particular vaccines to address the COVID-19 strain have been developed, but the technology itself, how long has that been under development?
I don't have an exact.
Almost 10 years, Bob. So okay. The technology itself has been around for 10 years, where they've used mRNA to treat disease and to develop treatment modalities. But as far as vaccination is concerned, this is the first time mRNA is being used in a vaccine, but it's no different than it being used within medicine, within the realm of medicine for the past 8 to 10 years.
Thank you.
Okay, so moving on to the Moderna vaccine, also mRNA vaccine. The study they had was the Cove study, which they actually published a pretty sturdy paper on. Over 30,000 participants, over 7,000 above the age of 65. They say 42% with high-risk chronic diseases, including severe obesity, diabetes, heart disease. Then they say 11,000 participants from communities of color. In general, the percentage breakdown for this was about the same as the Pfizer. Yeah, about the same. And in November 2020, they had the interim analysis of the first 95 volunteers who developed COVID. And again, we see pretty good numbers. They had 94.5% efficacy. 90 of the 95 cases occurred in the placebo group. 11 of the 95 cases were severe, and all of those were in the placebo group. Again, similar safety profile, similar side effects. I added this chart, which essentially, I think this was the best representation of the efficacy of the vaccine. So the two arrows you see are the first and second dose. Essentially, this chart shows the number of cases or the event rate over time. And you really see like a pretty significant separation within like the first 12 days of receiving the vaccine. But after, ideally, you still need the second dose just to like confirm and strengthen that immune response. This is just the proposed groups that were initially set out for who should receive the vaccines. People, essentially healthcare workers and people that are essentially just running into COVID frequently. Common question, if you receive the first dose, do you really have to? And the idea is yes, you do, because this is how the vaccine was studied. In general, people have said that even just having COVID, you sort of lose your immunity after 3 or so months. This helps try to maintain it for a longer time at the very least. Additionally, right now, the belief is that the vaccine gives significantly longer and stronger immunity than actually having it does. And things to think about are like, it's not just necessarily having it, because a lot of people do get over it, but there are long-term effects for people that do have it, and like things you want to try and avoid all of those effects. And that's including young people. Most common side effects. So like I was sort of saying before, the most common side effects are fever, headache, fatigue, muscle aches, and joint pain. These are generally short-lived, usually within the first 7 days of receiving the vaccine. Most of them are within the first 48 hours. There weren't any serious or life-threatening adverse events reported with either of the vaccines. Anaphylaxis was even very uncommon. According to the CDC, they had like about 20 cases of anaphylaxis, and all of them went home after epi, no admissions to the hospital and no deaths. They were, I believe the numbers they were quoting were about 11.1 people per million doses having anaphylaxis. So it's a pretty safe profile overall. The side effects they have been said to be similar to COVID, but they don't include respiratory in general. So if you were having respiratory symptoms, it's something to consider. You might want to talk to your doctor. It is always possible that you've been infected with COVID prior to receiving the vaccine, so that's something to consider. But in general, respiratory effects are not included in the side effects for this. If you're vaccinated, can you stop wearing a mask? General thought is no, you can't, you shouldn't, because no vaccine is really 100% effective. You should really continue using your PPE. Also, there is some question as to whether the vaccine can prevent asymptomatic spread. It's hard to tell at this point. Okay, so extra questions. Should you get vaccinated in pregnancy? So as of actually very recently, within the last week or so, I believe, the OB-GYN Association released a statement saying that if you are in the high-risk group, the vaccine shouldn't be withheld from pregnant people. It's still patient autonomy and patient choice. It's a conversation to have with your doctor about where you are in the pregnancy and the entire, all your other medical history. So it's something to talk about. But if you are in constant exposure to COVID, a lot of people are saying that you should most likely get it. But it's one of the things that you want to speak to your OB-GYN about if you're currently pregnant. On the other hand, they have said that if you are lactating or if you're trying to get pregnant and you are in constant exposure to COVID, then they recommend getting the vaccine, because the risks of getting COVID outweigh the risks of having the vaccine. Now, so far, there haven't been studies done on pregnant people with the vaccine, but they have done some studies involving essentially mice in terms of their, sorry, 1 second. They have done some studies in terms of mice and both during pregnancy and then while they're trying to get pregnant, and there haven't been any adverse effects, but this is why there's a little bit of have the conversation with your doctor recommendation. Are there preservatives? So there are a few. There's some sugars for stabilization. In general, there's no eggs, there's no latex. So those things you don't have to be as concerned about. They are saying that the big things to be concerned about in terms of anaphylaxis and just like allergic reactions are being aware. So if you do have an allergic reaction, a significant allergic reaction or anaphylaxis to the first dose, they recommend holding on the second dose. That's really the main one. There is a thought that if you have had anaphylaxis to a vaccine in the past, you might want to hold off. Now, there are a few differing thoughts. Some people say that because of that, with like the differing preservatives in the mRNA vaccines, it's not as much of an issue, but it is something to be aware of. And in general, if you've had vaccine reactions in the past, you'll have a little bit longer of a monitoring period after you receive your dose. If you're immunocompromised, it's not likely unsafe, but you might not mount as much of an immune response. That's really all there is to say right now. It's still recommended if you are in the high-risk group. Like I was saying, no egg products. And currently it's still going by the groups of exposure in terms of when people can get vaccinated. This is another question. Is it safe to get vaccinated if you've already had COVID? Like I was saying, the vaccine gives you a longer and stronger response than actually having COVID. So it is still recommended. There are recommendations as to waiting until at least 20 to 30 days after you've had the disease to get the vaccine, but it is still recommended. And just remember, these are like the key points from what we went over. There'll be more data, more people will get it. But overall, generally appears to be a safe vaccine at this point, and it is recommended. This is just a picture of where the mRNA actually works, which is, like I was saying, on the outside of the cell, not in the inside, so it doesn't actually affect your own DNA. And this is just a little joke, which is essentially what I was saying. The mRNA just sort of tells the rest of the body what to look out for. Haha. Okay, any other questions?
Thank you very much for that presentation. Does anyone have any questions?
I have one. I got my vaccination 2 weeks ago, Pfizer, first round. I'm supposed to get one in a week. They've said, based on the date that I got it, that they'll notify me, as opposed to me getting scheduled at the time that I got it. And what happens if they don't have the vaccine in time? How long can you go beyond that 3 to 4 week period for it to still be sensible and effective to get it?
So I've heard a few things. I think currently right now they're saying about 3 months. Within 3 months, you're most likely still going to be okay. Dr. Kumar, have you heard anything else regarding this?
I mean, the whole 3 to 4 weeks is the recommended time. I don't think they have an exact, this is your time frame. But essentially what they're trying to do is give you that initial response and reinforce and surmount the response. So if it does get delayed by a little bit, it should still be fine. But I don't know if we can give you an exact, it should not go beyond so many days.
What if they said, well, we don't have Pfizer, but we have Moderna? Can you mix them?
So the recommendation right now is to get the same thing. And that's what they're trying to tell everybody. But there are studies where they're trying to look at whether getting a different dose or a different type of vaccine is going to make a difference, or if the response is going to be any less. Because currently all the data that we have is based on people getting the same thing.
Understand.
So late last week, I think Johnson & Johnson came out with some data regarding the trials that they had with their vaccine. And that one is, I don't think has to be stored at as cold of temperatures as the two that are already on the market, but it seemed to be, it seemed to not have the same level of efficacy as the Pfizer and Moderna vaccines.
Right.
Are you concerned about that? Is that something that the folks watching this should be concerned about?
So it's a risk-benefit ratio, right? So it depends on what is available and what you're taking. So when you look at Pfizer and Moderna and you say 95% efficacy, that is a ridiculously high percentage of efficacy. When you get the flu vaccine every year, it is nowhere near 95%. It's probably in the 60s. So that's definitely a higher percentage of efficacy. Some places are getting... there are other countries outside of the US where they've already started giving, say, the Sinochem vaccine, which the efficacy is 65%. So there are parts of the world, what they're doing is they are giving that to the young and healthy to kind of build up herd immunity, and to the higher risk giving Pfizer, and kind of doing it that way just because of the supplies that they have. So it depends on what we have. I mean, at the end of the day, 95% efficacy is definitely better than 60% efficacy. No doubt about that, but it depends on what is available and how much of what vaccine we have.
Understood. Does anyone else have any questions?
What happens, say, next winter? Do we need to get another vaccine next winter, or like the flu vaccine, or you need to have one? So let's just say like Councilman Clay, he got his vaccine, and say he gets another one next week. In November, December, is he going to have another vaccine?
So the studies so Pfizer and Moderna, both of them started their studies sometime last year. And the people that were enrolled in the trial, they got their vaccines, and they're getting their blood tested every month for 2.5 years to measure their antibody levels in their blood. So as of now, we know that the immunity lasts for a little over 6 to 7 months, but we don't know long-term data yet. But as we go along, we're going to be able to know, and they'll be able to tell us, okay, this is when the antibodies died off, or this is when they needed a booster. This is where the consistent response kind of tapered off. If it gets to that, I mean, if it's once a year, hey, that's not too bad in my books. Better than getting COVID for sure.
Absolutely. Just like a regular flu shot.
Yeah, I mean, we're getting a regular flu shot every year with much less efficacy. So if this gives me 95% for once a year, I'll take that.
And for me, this shot was less painful than a flu shot. I barely felt it.
Yeah, no, my first one was, I barely felt it, and I hate needles and I hate being poked. And I was literally like, wait, are you done? I did not feel it. And the next day I had a little bit of ache, and that's about it. The second dose, I did have a little more symptoms, which is good, and it's expected. So I did have some body aches, but then so the first one, your body has recognized the spike protein. It's given you a little bit of side effects, maybe an arm ache. By the time the second one hits, it's like, oh, I know what to do. Let me fight that. So you get a little bit of body aches or flu-like symptoms. It lasted less than 12 hours. I was still able to function, get dinner on the table, and get the kids into bed. But I mean, it made me feel like, okay, so this is working. My body is surmounting a reaction to it.
Thank you very much.
Oh, I've got one other question for you. Are the two of you, can you tell us a little bit about the variants that have been identified, both I think from South Africa, Brazil, the concerns about that in relation to the vaccines that are being administered right now?
So at this point, we really have no published data of how the vaccine responds to, or how the variants respond to vaccinated individuals. Because, I mean, right now we've just vaccinated, we're not seeing as many variants. We'll need many more cases and more patients who have variants, and we need to be able to identify those variants and who has it to see if the vaccine is as effective. At the end of the day, there is some thought that it would still, even if it might not prevent it 100%, it might decrease the extent of your symptomatology. So it's still best to get it. And the sooner, sooner the population can get vaccinated and there's some herd immunity build up, hopefully there's some immunity against COVID and its variants, but hard to tell specifically about each variant at this point with where we are with the vaccines.
All right. Well, thank you very much. Does anyone else have any other questions?
Oh,
thank you. Oh, I'm sorry. Go ahead.
Sorry, I just wanted to add, if you do get the vaccine, that shouldn't interfere with your COVID testing, because I've been asked that as well. So if you did get the vaccine and you had symptoms and you got tested for COVID, your COVID testing should not be positive just because you're vaccinated. It's unrelated.
Good point. Good point. Thank you for bringing that up. Well, we certainly appreciate your time this evening and helping to get more information into our community about the COVID-19 vaccines and the state of the virus in our community. So thank you again, both of you, for your time. And thank you, Chief Elmore, for setting this up. And we will continue to have this conversation at every meeting so we can continue to get out more information. Ms. Miller, is there anything else on the agenda for the workshop session?
No, ma'am, that is it.
All right. So we didn't quite wrap up executive session. So at this time, I will take a motion to re-enter for the purposes of real estate litigation and personnel.
So moved.
Is there a second?
Second.
Thank you, Councilman Allen. All those in favor? All right, that is unanimous. We'll see you at the other link. Thank you.
Thank you all.
Thank you.